Merkel Cell Carcinoma, or MCC, is a rare and highly aggressive skin cancer that arises from Merkel cells, which are specialized sensory cells in the epidermis. It is most commonly associated with Merkel cell polyomavirus, or MCPIV, which integrates into the tumor's genome and expresses viral oncoproteins, promoting uncontrolled cell division. In addition to the viral factor, mutations in tumor suppressor genes like TP53 and RB1 contribute to the development of MCC by impairing the body's ability to control cell growth. Clinically, MCC presents as a rapidly growing, painless, firm, and often erythematous nodule, commonly on sun-exposed areas such as the head, neck, and arms. The tumor may have a shiny, translucent appearance and can be associated with regional lymphadenopathy due to early lymphatic spread. Diagnosis is confirmed through skin biopsy, where histology typically reveals small, blue, round cells positive for neuroendocrine markers like chromogranin, synaptophysin, and CK20. Immunohistochemistry for MCPIV is used in most cases to confirm the viral presence in the tumor cells. Treatment for MCC usually involves surgical excision, aiming for clear margins to prevent local recurrence. Radiotherapy is commonly used post-surgery, especially if there is lymph node involvement or unclear margins. For advanced or metastatic MCC, chemotherapy with platinum-based regimens is typically used, though outcomes are poor. However, immunotherapy has significantly improved treatment outcomes. Checkpoint inhibitors, which target PD-1, have shown remarkable efficacy in treating metastatic MCC. While no specific prevention exists, reducing ultraviolet exposure is crucial since excessive sun exposure increases the risk of Merkel cell carcinoma. Though the role of Merkel cell polyomavirus in MCC suggests that immune system health may also be important, this remains an area of ongoing research. Merkel cell carcinoma remains a highly aggressive cancer, but advances in immunotherapy offer new hope for patients. Subscribe and like for more science-based content, and thanks for watching. This lecture is intended for educational purposes only and does not replace medical advice.